Are you taking vitamin D3 to stop hair loss? Be careful. Too much may contribute to even more shedding. Vitamin D is important for the hair follicle, but there is no scientifically established dose that makes everyone's hair grow. When high-dose supplements are taken without testing or medical supervision, vitamin D can accumulate, raise blood calcium, and disturb the body enough to disrupt the normal hair growth cycle. Vitamin D deficiency is frequently associated with hair thinning and conditions such as telogen effluvium and alopecia areata. But it does not mean that taking more vitamin D will automatically improve hair growth. Vitamin D already comes from several sources. Small amounts occur naturally in foods such as fatty fish, egg yolks, and butter. It is also added to many everyday products, including milk, plant-based beverages, cereals, yogurt, and some orange juices. The amount may appear on the label, but realistically, who calculates the vitamin D from every food consumed throughout the day? Most people do not. Then they add a vitamin D3 supplement on top of everything else, sometimes without knowing whether they are deficient. Vitamin D is fat-soluble, which means excessive amounts can accumulate in the body. Severe excess can raise calcium in the blood, causing a condition called hypercalcemia. This can produce nausea, vomiting, extreme thirst, frequent urination, muscle weakness, fatigue, dizziness, confusion, and bone pain. It also places the body under significant physiological stress. This stress can push more hairs out of the growing phase and into the resting and shedding phase. The result may be diffuse hair loss several weeks or even months later. Vitamin D toxicity almost always comes from excessive supplementation, not from normal sun exposure, because the skin regulates its own vitamin D production. So do not keep increasing vitamin D3 simply because your hair is falling. With vitamin D, more is not necessarily better. Follow for more nutrition truths.